What makes this series unique compared to other resources available to those in the neuropsychology field?
Well, I would think there's something to be said about having kind of a common voice. The series, whenever you start talking about a series, I think all the texts, even though they will focus on different domains or different aspects, they are grounded in the same principles of what we're wanting to accomplish and what we're wanting to discuss. So these resources really set themselves apart because we have the clinician in mind first and foremost, integrating the new empirical evidence in terms of how we need to practice from an empirical-based, evidence-based standpoint. So in that regard, I think we really start to set ourselves apart because there is that continuity, if you will, of the series in terms of covering those major domains and focusing on them in a way that is going to be most applicable to clinicians, whether they are at a student level or at a senior professional level.
Mm-hmm. And so you mentioned a little bit about changes in the field. How do you see the neuropsychology profession changing, and how do you anticipate the Contemporary Neuropsychology series responding to new trends and needs in this field?
I think as we continue to, when you start looking at areas of practice such as just general medicine, infectious disease, different areas of practice, there is a growing desire to look at quality of life aspects. One, across most presentations, including cancer, which one of our first books in the series is focused on. One of the areas that consistently is at the top of the list for patients when they're talking about quality of life is cognitive effects of different diseases, manifestations, and medical interventions. So as we continue to improve our medical technologies and how we intervene for patients on the medical end of things, we're becoming much more aware of the aspects of quality of life that we need to pay attention to, which includes the cognitive piece, the neuropsychological piece. And again, not everybody within the neuropsychology field is as well versed. Everybody kind of carves out their niche, if you will, of area of practice. So we want to create this library of texts that covers those new domains, which is why we really came up with the idea of it being a contemporary neuropsychology, because this is not the same old stuff that we've been doing for the past 20 or 30 years. This is really expanding and looking into areas that previously were ignored. The first book, The Neuropsychology of Psychopathology, is really rooted in the idea of these neuropsychiatric presentations that we are encountering. A big aspect of these individuals' level of functioning is how they are doing from a cognitive standpoint. And neuropsychologists are being called on more and more to offer those services. It's not the argument from the 70s and 80s of differentiating whether this is a functional or organic-based presentation. We know that dichotomy is inaccurate. We can't look at it in that standpoint. But still, neuropsychologists are being called on in that specific population to improve functionality on a day-to-day basis. And I think that applies across many different domains. There's constantly new emerging evidence in areas such as cortical dementias when you start talking about biomarker data and advances in neuroimaging. So our field, the neuroscience field, is changing at a rate quicker than probably any other clinical practice that one can encounter. And so we want to offer a library that offers those new changes and covers those essential resources for clinicians.
Mm-hmm. Well, thank you again, Dr. Noggle. So we'll look for the publication of Neuropsychology of Psychopathology, publishing this month, and we look forward to the upcoming publication of Neuropsychology of Rehabilitation. Thank you.